Hamuhle makoti, hamuhle safika, uyothu ngejwayela, besukahlela indoda, uyikahlela indoda. Hamuhle makoti, hamuhle safika, uyothu ngejwayela, besukahlela indoda, uyikahlela indoda. When uyothu ngejwayela, besukahlela indoda.
I'm Harold Robles, co-founder and president of the Medical Knowledge Institute MKI here in Southern Africa, where we try to prevent curable diseases simply through education. In the coming days, I will be taking you along to our activities here in Southern Africa, and will be visiting with you our centers and will share with you the educational activities that are taking place. This is where it all starts, in the townships of Southern Africa, where MKI is bringing the knowledge to the people how to deal with all kinds of curable diseases. Because children are growing up in these places, filthy, garbage all around, all kinds of diseases in this kind of water. Nobody knows what hygiene is all about. Children don't even know how to wash their hands. Don't forget that of all the curable diseases in this country, children under 5, only 3% die of AIDS, 13% of diarrhea. That's the problem in these communities. We have to bring the knowledge to them so that they are empowered to take care of themselves, their community, their family. That is extraordinarily important, and that is what MKI brings to the townships of Southern Africa. As we all know, there are so many women with HIV and AIDS, or TB, or any other communicable diseases in Southern Africa. But it is very hard to find someone to really talk about their disease. In most cases, people are still ignorant, in denial, and very much ashamed of themselves. 2 MKI facilitators are talking about the deaths of their family.
After I've lost the members of my family, it was quite sad because it was ignorance.
Yes, I lost my brother, not knowing that he's HIV positive, because he was always said he's got this and tired, and that when we took him to the clinic, we never know. He never want us to take him we go with him in the clinic. So we never know what's wrong with him. We were just there not knowing what to do. And then he passed away. We got that later when he passed away. The doctor told us that he was HIV and it was really bad, it was AIDS.
After the 3rd person died, that's where we got a wake-up call that, guys, we must try to do something, get information somewhere. This disease is going to destroy everyone.
I felt bad. Really, I was so sad, even now. Because if I knew that time, at least you could be alive by now.
Education is the best, because without education, you will not be able to take the medication accordingly.
I would like to thank MKI, because now he changed my life a lot. Now I'm going to change the community's life also, and especially youth.
Today, I'm taking you to one of the MKI centers here in the township of Khayelitsha, where education is being taught to prevent curable diseases. Good morning everyone. You okay? Come along. The lessons are now in session.
Welcome. Today's education is about good hygiene. It's always good when you come from the toilet or you will start to eat, to wash your hands, to prevent you to get diarrhea. But by the way, no matter you are, prevention is better than what? Sure. The pen is supposed to be what? To be erected. Thank you. You cannot put it to your penis if your penis is not what? It's not erected.
People in the townships of Southern Africa are still not aware of the seriousness of HIV and AIDS and other communicable diseases. Some don't even know that these diseases really exist. Some think it will never happen to me. I shower after I have sex. I pee after I have sex, so I cannot get sick. After having heard this over and over again, I started to think education was my answer.
Okay, I will give everyone, female or male, a condom.
And this is how they always end their lessons here in Khayelitsha, thanking the Lord for the knowledge that they have received. And it is always very, very emotional. You Will, or You Will Make a Difference, is a project of the Medical Knowledge Institute. It is a program where women infected with HIV and AIDS can earn money, make beautiful jewelry, and get the education that they deserve. So in every way, a win-win situation. Children are our future. A common use sentence, but still very applicable in the townships of Southern Africa. If we start to educate the children about simple things like washing hands, they will not die of diarrhea. Usually, when a young girl is menstruating for the first time, she thinks that she's being cursed by God or the devil. We need to start educating them young to prevent. MKI has built a good relationship with the Clover Mama Africa project. Clover is a very large dairy company in South Africa. The Clover Mama Africa project looks after abused, abandoned, orphaned, and HIV/AIDS children, as well as some elderly. This is all being done by dedicated mamas spread over the 9 provinces of South Africa. Thanks to the support of Clover, MKI is now able to reach more than 25,000 plus children to educate them on all kinds of public health issues, such as hygiene, oral health, etc.
The children that are staying with us is from 3 months up to 6 years. But now we are extending the program because we've got an after-school care. That is the children from the primary school, whereby we've got the opportunity of teaching them about their health issues and about this menstrual hygiene as well, so that when they get to that stage of menstrual hygiene, so they know how to look after themselves.
I try to clean the teeth, and we say wash the hands. If you go to the toilet, you wash the hands. So they make a big difference. MKI and Mama Africa is a big difference, especially for me.
I love the idea of educating the people in the community about health-related issues.
I'm on my way to the Khayelitsha clinic here in the township of Khayelitsha, where MKI is doing a pilot on a health passport. A passport that is going to be used, that's being used right now, for patients' information. This will eliminate waiting in line to see the doctor, because all the information is right in this passport. Eventually, this passport will be changed into a card with a chip with all the information of the patient. This is very important. I'm on my way now to meet with Dr. Tom Garvin, the medical director of MKI, to discuss the process of this program. How are the patients responding to the health passport?
Very well. It took them a while to get used to it, to learn the new thing, but they are recognizing that the passport empowers them, and that is very important, and how good it is for them, so they can come to the clinic, that the doctor understands what's going on, with them, and that they can travel to to the Eastern Cape mostly.
Fantastic. So that little booklet is really working.
It's a very good project, and it will be, once everybody has it and understands it, it will be a very big success. Okay. With this, you go pharmacia and come back in 2 weeks.
In 2 weeks.
Today is a very important day for MKI here in Khayelitsha because the Archbishop Emeritus, Desmond Tutu, a member of MKI's Board of Advisors, will be visiting the center and will be celebrating with us the graduation of some of our students. So you can imagine it has been going on for days, the preparation, and I would like to share with you what is going to happen today. Be prepared because it's going to be absolutely fun. Good to see you again.
How are you?
I'm fine, my friend. Such a long time ago. People ask me why I'm doing it. It is for them. The future of this country, the future of this continent. I have sleepless nights thinking of these kids every day, that they have to play and live under these circumstances. That is why MKI is here, to bring them to knowledge, to deal with the public health problems that they are exposed to every single day. They are the future of tomorrow. Let's never forget that.
In many places where people are not educated, a straightforward thing like maybe diarrhea, they might say is due to witchcraft or things of that kind. And yet it's actually a fairly straightforward thing. I mean, if you have clean water and you are yourself careful, you can actually be able to deal with it. But even more importantly is how you help a dehydrated child be rehydrated. And knowledge, they say, is strength.
Thanks to the partnership with Medical Knowledge Institute, we are able to reach to more than 20,000 children countrywide with valuable health information, basic information from teaching the children how to brush their teeth and why it's important to brush their teeth 3 times a day or twice a day, wash their hands, why it's important to wash their hands to keep the ordinary germs away. And this project is just growing with 33 mamas countrywide. Currently MKI is helping us reach to more than 20,000 children. We anticipate reaching 100,000 children within the next 2-3 years.
MKI is doing prevention through education, but other organizations, NGOs around Khayelitsha, their focus is around diagnosis. That's the difference between MKI and other organizations.
I feel very excited that MKI and the Desmond Tutu HIV Foundation have found each other and have a relationship and a partnership together. It's not all about going it alone. We can do so much more if we come together, work together. And MKI are establishing an outstanding reputation. We believe we too have a good reputation within our communities, and to work together is going to benefit many, many people.
If you ask me what I think of MKI, I'd say MKI is for health education for each. And that's exactly what we preach.
I want to commend Dr. Robles, who has an incredible passion. I mean, he could have been enjoying himself in Amsterdam or wherever, but he has the passion and the commitment of a missionary.
I'm often asked why I'm doing what I'm doing today. I was inspired at the age of 11 by one man by the name of Albert Schweitzer, well known for his work, for his great work that he did in West Africa, in Lambaréné, Gabon. What I am today and what I'm doing today is because of this man who inspired me to serve humanity, who inspired me to have reverence for life.